Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Nigeria is still grappling with the diphtheria disease outbreak since 2022, as it has continued to spread across other states in the country. So far, 836 cases have been confirmed, with a total of 83 persons reportedly dead, out of an estimated 2,455 suspected cases reported in 26 states within 15 months in Nigeria. Diphtheria is now a cause for more worry, as 836 of the cases have been confirmed in 33 local government areas across 8 states in the country as of July 27, 2023. But health authorities say suboptimal vaccination coverage is responsible for outbreaks. Let's take a look at the situation in some of these affected states and measures taken so far.
The suspected cases of the disease were recorded in Kafanchan and Makarfi local government areas of the state. This is the ward where people with suspected cases are being isolated and no one goes in or out of the ward except medical personnel. Dr. Yusuf Abubakar, the medical director of Makarfi General Hospital, where the patients are isolated, explained that deaths have been recorded from the suspected cases.
So the patient we received them on Friday. We received 9 patients, which were suspected of having diphtheria from Gubuchi, from Gubuchi ward, which is part of Makarfi local government. Already there were some 3 patients that died before coming to the hospital. So the 9 people we received were just suspected cases. Their samples were collected on Saturday. We are hoping to get the results hopefully tomorrow.
Dr. Abubakar said the patients are now in good condition.
And so far so good. All the 12 patients we have, they are doing well. In fact, we are hoping to discharge them very soon.
Though people are going about their daily activities in Makarfi town, the news of the outbreak of the diphtheria disease has, however, sent chills down their spine. We are not happy with the outbreak of the diphtheria disease in our community, but we are praying that God will help us contain it. We are also appealing to the government to take measures to prevent the spread of the disease. We are worried about the situation, and we don't understand how government is handling the spread of the disease. So we need more sensitization and preventive measures for the disease. While allaying fears of a possible escalation, Dr. Abubakar assured that measures are being put in place to contain further spread of the disease.
Thank God in Makarfi, we have been able to contain it. We, along with the local government, we have been able to put proactive measures. And right now, we can assure people to calm down, that the case is under control.
So far, out of the 16 suspect cases in Makarfi local government, 4 patients died before coming to the hospital, while 12 people are still receiving treatment there. However, while compiling this report, another suspected case of a 14-year-old arrived Makarfi General Hospital.
The index case of diphtheria infection in Osun State was a 6-year-old boy who died on July 7th after showing symptoms. The test conducted confirmed that the boy died from the infection. The state government immediately launched contact tracing and activated emergency response center at the State Ministry of Health in Osogbo to prevent the spread of the infection in the state. The Permanent Secretary, Osun State Ministry of Health, Isiaka Adekunle, said the state government is working with the Federal Ministry of Health to prevent the spread of the infection among residents.
We only have this index case. Yes, we may have some suspected cases, but once it has not been confirmed, we cannot say, I can't say this is the number of suspected cases until there is confirmation. So for now, no other case apart from this particular one.
Adekunle appealed to residents not to panic, saying that the infection is preventable and treatable. He advised parents especially mothers, to ensure that their children are fully vaccinated so as not to be infected.
It is a treatable disease, and above all, it is even preventable by taking immunization. Adults need not to be afraid. Adults need not to be afraid. And if our children had been fully immunized, we don't need to be afraid.
However, most people in the state are not aware of the disease, a pointer that the state government needs to intensify sensitization against the disease.
Diphtheria is a serious infection caused by strains of bacteria that make toxin. It can lead to difficulty breathing, heart rhythm problems, and even death. In Nigeria, the very first cases of suspected diphtheria in the latest outbreak were recorded in December 2022 in Lagos and Kano. At the time, the Nigeria Center for Disease Control and Prevention officially declared an outbreak of diphtheria cases in Lagos and Kano states, which were the first to confirm the outbreak. The disease quickly spread to other states, a situation that left Nigeria witnessing an outbreak. This is why stakeholders are taking action to avert a further spread and its attendant consequences.
Nigeria already have the vaccine integrated into the routine immunization, so it is already integrated in the national plan. So all we have to do is to ensure that we are fully immunized and the children get the immunization as required according to the national schedule. This disease, as I said, is mostly in Kano, then Lagos, Osun and Katsina, and there's also some cases that is reported in Cross River. The government is still tracking to understand how much, what the severity of the disease is.
Some symptoms and preventive measures against diphtheria were elected in order to increase the awareness level of the disease among Nigerians.
Vaccination is really a key prevention method, and also key messages where the Nigerian Red Cross will be focusing their actions on to ensure that people that are at high risk, which are children under 5 years old, pregnant mothers, and also adults as well, for up to the age of 14 years old and also over the age of that, who have not taken the diphtheria vaccine. So they are all encouraged to come out into the from their communities and go to the nearest health facilities and take the vaccines. I do suggest a declaration of a state of emergency for the diphtheria outbreak because the uptake of routine immunization has suffered a lot due to the COVID-19 pandemic, and also increase and focus on COVID-19 vaccination. So there is a need for children that have not been vaccinated, even adults that have never taken the vaccines, to improve their vaccination intake.
They unanimously urged the federal government to declare a state of emergency against the disease before it gets out of hand.
I think it's probably going to occur in other states. I think it's just gradually coming. It's accumulation of incomplete vaccination of our children. And over the years, we have been accumulating vulnerable children. So if you have 100 children this year and you vaccinate only 60 of them, that means you have 40. Next year you have the same thing, the number becomes 80. We're probably getting 1 or 2 cases of diphtheria in the past time, but now we have this large number of vulnerable children, and they're coming about the same time. That's why we're shouting epidemic or outbreak or something. I think it's a failure of the past, whether we like it or not. If we had done our immunization up to 80% or more, we won't be talking about diphtheria. If you have been vaccinated, you're still protected. There's no doubt about that, and that's what happens. Like yellow fever, you vaccinate a large number, and then you can reduce the spread. Like polio itself, you have your large number of children, then you don't have what we're circulating vaccine-derived polio. So those are the kind of things. So raise your immunity coverage for all your children, and then you can prevent a lot of these vaccine-preventable diseases. That's the whole essence of vaccination.
Diphtheria, a highly contagious vaccine-preventable disease caused by the bacterium Corynebacterium diphtheria, is mainly spread through direct contact with an infected person or exposure to airborne droplets, which has been declared an outbreak in the country. But let's go on a quick break now, and when we return, we'll quickly take a look at the response from national and sub-national levels to contain the spread. Don't go away, we'll be right back. Welcome back. If you're just joining in, this is the program Healthy Living on Trust Television, and following concerns over expansion of the diphtheria outbreak in the country to newer states through an increased number of suspected and confirmed cases and mortality, the federal government, through the National Primary Healthcare Development Agency, the Nigeria Center for Disease Control and Prevention, and its partners say they are mobilizing all necessary resources to respond effectively to this outbreak by detecting cases early, containing the spread, preventing further transmission, and escalating routine immunization and vaccination in states.
There is concern over the outbreak of diphtheria cases across the country. From May 2022 to July 2023, an estimated 2,455 suspected cases has been reported in 26 states. As of July 27, 2023, 836 of these cases have been confirmed in 33 LGS across 8 states: Cross River, Kano, Katsina, Kaduna, Lagos, Osun, Yobe, and the FCT. Tragically, 83 deaths have been reported from these confirmed cases, making vaccination against the deadly disease critically important, especially for our children. Diphtheria is a highly contagious vaccine-preventable disease caused by the bacterium Corynebacterium diphtheria, mainly spread through direct contact with an infected person or exposure to airborne droplets. It poses a severe risk to people of all ages, particularly our children. Unfortunately, there are still children who are unvaccinated despite the availability of free vaccines in the country's routine immunization schedule. The disease primarily affects the respiratory system. The symptoms include fever, cough, runny nose, sore throat, neck swelling, and breathing difficulties. If left untreated, these symptoms can lead to death, with a higher risk for partially vaccinated or unvaccinated children in crowded and unsanitary areas. Adherence to proper hygiene practices is crucial in preventing the spread of diphtheria. Simple yet effective measures like hand hygiene, maintaining good cough etiquette, environmental cleaning, eating nutritious balanced meals, isolating and quarantine of suspected cases can significantly reduce the risk of infection. Diphtheria is totally preventable through vaccination. In Nigeria, pentavalent vaccines are used to protect against diphtheria and are administered to children at 6 weeks, 10 weeks, and 14 weeks of age, with additional doses being given during campaigns. The pentavalent vaccine contains 5 antigens that protect against diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenzae type B. Despite the efforts of the federal government to provide safe and cost-effective vaccines, a significant number of children remain unvaccinated or partially vaccinated. This suboptimal vaccination compromises the country's goal of achieving population immunity. Suboptimal vaccination coverage has been the main factor contributing to these outbreaks, with the most affected age groups being those between 2 to 14 years. At MPH-CDA, in collaboration with the Federal Ministry of Health, the NCDC, and our partners, we are mobilizing all necessary resources to respond effectively to this outbreak. A comprehensive plan has been activated to detect cases early, contain the spread and prevent further transmission through a multi-phased strategy. To facilitate our immediate response plan, we are leveraging surveillance data from the NCDC, direct information from the states to ensure effective planning and resource deployment. The agency is working closely with partners to ensure adequate supplies of tetanus TD for those children between 4 to 14 years and pentavalent vaccines for children under 4 years. Currently, we're collaborating with the affected state teams and other stakeholders to conduct intensified immediate response vaccinations to identify at-risk populations in the affected states, administering pentavalent and TD vaccines. Additionally, we are conducting awareness campaigns to educate the public about the disease, its symptoms, and preventive measures. The response to the ongoing diphtheria outbreak will be carried out in 2 phases. Now, we have provided this in the map below, so you can see for the immediate phase 1 response, that the immediate response, you can see in that top map, and then below that, the phase 2, which is a more expanded in scope campaign. We've also shown in the maps behind me the 0-dose LGAs. Those are the LGAs where the number of kids that are being reached with vaccinations are suboptimal, despite the availability of these vaccines. There are 100 of these 0-dose LGAs. In phase 1, the immediate response, this will encompass 25 LGAs across 4 states, Bauchi, Katsina, Yobe, and Kaduna. This phase is scheduled to begin on the 7th of August 2023 and will continue until the 11th of August 2023. The phase 2 will cover outbreak response in 171 LGAs across 6 states. These states are Kano, Katsina, the FCT, Yobe, Kaduna, and Bauchi. These states will have a statewide outbreak response, while there will be targeted outbreak responses in LGAs across 8 states. These are Jigawa, that will have 8 LGAs, Borno 4 LGAs, Oshun 4 LGAs, Lagos 3 LGAs, Zamfara 3 LGAs, Gombe 3 LGAs, Plateau 1 LGA, and Nasarawa with also 1 LGA. This phase is planned to be conducted in 3 rounds to rhyme with the 3 doses of the pentavalent vaccine. The first round will commence on the 21st of August 2023, followed by the second and third rounds tentatively set for the 18th of September and the 16th of October, respectively. Each of these 3 rounds will span 5 days. The geographical areas to be covered in the response are depicted again in the maps that we have posted on the walls. The vaccination campaign will utilize fixed and mobile teams so that we get as much as possible to where people live and work. Parents and caregivers are therefore urged to take their children from birth to 14 years to nearby health facilities or vaccination centers to get these vaccines.
Over 80 deaths. So translating to case fatality rate of about 9%. And this is unacceptable in a situation where we have vaccines that can prevent this disease. And like most of the people affected are children under 14 years of age. And we think with adequate vaccination coverage, we could have avoided this. And most of them, from data that we have, 22% of the confirmed cases were only immunized. The rest were not vaccinated. So it therefore means that is to communicate to every stakeholders across level and across board to ensure that they support routine immunization to continue to safeguard the lives of our children. Some other efforts NCDC has done is to say establish national diphtheria technical working group that use One Health approach and that engages all the partners and MDAs. And then we have also supported the states where they have had outbreak to establish incident management system. And we've supported development of capacity for the laboratories in these states to be able to confirm diphtheria, to make response faster. closer to the states, make it more effective and more efficient. Then we've also deployed RRT with the support of WHO and other partners to the affected states to be able to provide technical support to the states for them to be able to address emerging issues and then bring this under control. And risk communication is crucial, is a critical part of this that we've been doing, and using our National Risk Communication Technical Working Group and providing support to the affected states. And then we're also doing this in conjunction with our colleagues working from Advocacy Communication and Social Mobilization from National Primary Healthcare Development Agency. Other partners who are based in the states, especially affected states, are also supporting these efforts, and we want to use this opportunity to thank them. And then, of course, supporting the routine immunization, intensification of routine immunization in the states, working collaboratively with the MPACDA that are leading on this.
You may wonder why the NCDC asked the WHO to intervene by organizing and supplying shipment of erythromycin, antibiotics, and tetracycline because of some suspected cases of antimicrobial resistance during the treatment and management of diphtheria. But let's take a look.
WHO is aware that a diphtheria outbreak is on in Nigeria, and indeed is expanding, reaching a new state. The National Focal Point for International Health Regulation, which is the NCDC, indeed informed WHO from the onset of the outbreak somewhere last year. And in order to support the country to respond adequately to the outbreak, WHO was requested by NCDC to help procure diphtheria antitoxin and injectable erythromycin for case management of diphtheria cases. This is because the antibiotics being used currently to treat diphtheria cases have shown that there is some resistance of the Corynebacterium diphtheria to the antibiotic. So it's also part of the reason why we are seeing high mortality in some of the locations. Diphtheria antitoxin and erythromycin are important tools alongside other tools to curtail the outbreak, from surveillance, contact tracing, isolation of cases, identification of contact, treatment of contact with prophylactic antibiotics, risk communication and community empowerment engagement, fighting infodemics, and many others, laboratory support to confirm the case and the spread, transport of samples. So it's really a comprehensive strategy that has been in place in Nigeria and for which WHO has been called upon to help. As of today, 1,800 vials of diphtheria antitoxin is expected to arrive in country on 2nd of August, and erythromycin to follow in the next 1 or 2 weeks, pending, of course, other normal government clearance. These health commodities are essential for saving lives and reduce the sequelae in the affected patients, thus need to be prepositioned in country and ready to be deployed in the state. As we speak, we have DAT prepositioned in not yet affected states. I would like to call upon on those state authorities to release those DAT prepositioned in those states to support the response where cases are occurring, so that when we receive later tomorrow, or after tomorrow, the 1,800 DAT doses, they can be used to replenish rather than hoarding DAT in the states that are not yet reporting cases. The last weekend, NCDC requested from WHO also for the deployment of 18 rapid response teams to support the new site, Bauchi, Kaduna, and Katsina response. The deployment process is underway following the requested profile and the mix of workforce from the Nigeria Field Epidemiology and Laboratory Training Program and AVOC Surge, and also WHO staff. WHO team is also on ground in Yobe and Kano, improving the surveillance at their facility and community level, supporting the active case search and supporting the centralized isolation centers and referral to the State Reference Treatment Center in alignment with the State Ministry of Health requests and NCDC guidelines. WHO is also supporting FCT in conducting an integrated active case search and household sensitization in FCT, optimizing the opportunity for the FIPV and NOPV2 routine immunization intensification campaign. WHO is supporting the procurement of lab commodities to increase the result turnaround time to support the case definition and management of early stage. WHO is also working with NPSCDA to organize the first phase of vaccination campaign targeting children 0 to 14 years in 4 states, and WHO will support with 19 million naira. We are also in touch with NCDC, and I'm sure the Executive Director will be able to inform the press on actions being taken in terms of reactive vaccination.
When you look to the data, you see that actually 70% of the children affected are over 2 years old. And as well that 80% were not vaccinated or vaccinated in an incomplete manner. So to us it's clear that the COVID pandemic affected the speed that the MPHCA was having to really increase the coverage. Coverage increased, but still we are missing the 0-dose children. That's the why. We are seeing cases of children from 2, 3, 4, 5, up to 10, 14 years old. Most of the deaths are children from 5 to 9 years old. So this is what we are trying to address inequalities and to address the children that we are missing, that they were lost during COVID-19 times. The outbreak now is affecting states like Bauchi, Katsina, Kaduna, and Yobe. What we are doing as UNICEF to support the efforts that MPHCA is leading at national and state level. In Yobe, for example, we have been supporting 3 treatment centers for diphtheria, including the Maturu, but as well, allow me, I don't know the pronunciation, Portiscum and Nguru in Yobe state, but as well, for example, in Kaduna, we have been supporting more than 180 teams to do response vaccination. As well, I'm happy to commit here publicly today, based on the request from MPHCA from Friday, that we are going to support the MPHCA efforts with 20 million additional nairas to ensure that the reactive vaccination is successful.
And that wraps up this episode of the program. I hope it has given you the much needed insight on the diphtheria outbreak response. Remember to stay healthy. For comments, contribution and suggestions on this episode of the program, do well to subscribe, follow and like all of our social media platforms. Till I come your way again, I am Aisha Salihu. Thanks for watching.